Hi, my name is Rachel Carmichael, and I'm going to be performing an assessment of the head, ear, eyes, nose, and throat, and this is my patient, Brittany. So first, I would come in and introduce myself and wash my hands and put on gloves. Hi, Brittany. My name is Rachel Carmichael, and I'm a nurse practitioner student, and I'm going to be performing an assessment of your head, ears, eyes, nose, and throat. Perfect. Hi, Rachel. Hi. So first off, I'm going to note that Brittany does not appear to have a disheveled appearance. There's no rips on her shirt. She's able to hold her own posture. She does not appear to be in any distress whatsoever. And I don't see any signs of abuse from an outward appearance standpoint. And so moving on, Brittany, what I'm going to do first is assess your head. And so I'm going to notice that first off, her hair appears to be evenly distributed. And it is nice and thick. It does not appear to be brittle at all. It's soft to the touch. It's a brown into blonde balayage. So it's colored at some points, but it's appears to be nice, healthy hair. I'm also going to look for any dandruff. And Brittany, have you noticed any dandruff?
I don't think so.
Okay. Great, so I'm also going to look at her scalp. I'm just going to check the skin, looks for any lumps, bumps, protrusions. So I'm just going to look at your skin, Brittany. I don't see anything so far. Okay. Yeah. I don't see any nevi. I don't see any lesions, any dry patches or redness. The color of her skin, of her hair, appears to be equally distributed throughout her scalp, or rather the color of her skin appears to be equally distributed throughout her scalp. I didn't notice any dry patches or anything like that. I'm also going to look at your face, Brittany, and I see, other than some freckles and some nevi, I don't see any acne, any pimples whatsoever, any dry patches. Have you had any irritation of your skin or anything like that? Yeah. And the color of her skin appears to be white, equally distributed, consistent throughout. I'm just going to feel your facial bones. Okay. Now I'm just going to look at facial symmetry. Go ahead and smile for me. Great. I see that her expression was equal bilaterally. I don't see any involuntary movements, anything of that nature. What I'm going to do now, Brittany, is palpate your temporal arteries. Okay, and they appear to be a 2+. I don't feel any thrills whatsoever. I'm also going to test your temporomandibular joint, Brittany. And so go ahead and open and close your mouth. Great, great. And facial bones. Yeah, so temporomandibular joint, I didn't hear any clicking whatsoever. It was equal movement bilaterally. Did you have any pain when you open and close your jaw? Awesome. So now I'm going to look at your eyes. I'm going to notice that your eyelids and eyebrows, the hair distribution is equal bilaterally. I don't see any lesions or anything like that. Okay. Your eyes appear to be, the eyelids appear to be pink. They're not irritated, no sign of irritation or redness. I'm going to look at the conjunctiva. Notice that it's clear and that the sclera is white, nice and white. I don't see any yellow, yellowing of the sclera, which would be consistent with jaundice. I also see that your, I'm going to check your lacrimal glands, lacrimal sacs. Did you feel any pain or tenderness when I did that? Okay, I didn't see any discharge or anything coming from tear ducts when I palpated them. I didn't feel any masses. I didn't feel anything out of the ordinary, and it was equal bilaterally. What I'm also going to do is test your confrontation. And so, Brittany, I want you to keep your head straight. And then I want you to tell me when you see my fingers come into your line of vision, okay?
Right there. There. There.
Okay.
There. There. There.
Awesome. So we're doing good there. What I'm going to do next is look for any extraocular movements. And so, Brittany, what I want you to do is keep your head straight and then follow my finger with your eyes only, okay? Okay, and I did not see any extraocular movements whatsoever. The movement of her eyes, was equal bilaterally. And so I didn't see anything there. I'm also going to now just look at the pupil size. I'm going to see we're about a 4 for pupil size, and it's equal bilaterally. What I'm also going to do is just now look at, just shine a light inside your eyes. Okay. Okay, so I noticed that direct reaction, the pupil did constrict, and also concentric reaction for both the pupil did constrict, and that was equal bilaterally. What I am going to do now, Brittany, is have you keep your head straight, and then I want you to follow my finger as I come towards your nose, okay?
Mm-hmm.
Awesome, so I did notice that the pupils did constrict to accommodate, and it was equal bilaterally. Now, Brittany, what I'm going to do is just look inside your eyes, maybe a little uncomfortable. Bear with me, it'll only be for just a few minutes, okay?
Mm-hmm.
Okay, so I see the red reflex. I see the optic disc is yellowish orange, and that it appears to be clear. Open your eyes for me, Brittany. There we go, clear lines, it's not blurred. I see the vasculature by the optic disc. I also see that the retinal background is free of any lesions. Okay, and I saw the macula as well. I'm going to look in this eye. See the optic disc, clear lines, not blurred. No lesions in the retinal background, and the red reflex, the macula, and the vessels. So we're looking good there. Now, Brittany, I'm going to look in your ears. And so I'm going to see with both of your ears, I don't see any discharge. I see the helix, the tragus, but no obvious discharge or anything like that. Brittany, have you noticed any ringing in your ears? Any decreased ability to hear, pain, tenderness in your ears? No. Okay, awesome. No discharge coming from them? Great. So what I'm going to do is I'm going to stand behind you and whisper some words, and I want you to repeat them back to me, okay?
Okay. 3, 2, 1. Light, bright, tight.
Awesome. Great. So she was able to repeat all of the words back to me, which tells me that gross hearing is intact. Now, Brittany, what I'm going to do is I'm going to take this tuning fork, and I am going to put it on top of your head. You're going to look like a Teletubby. And I'm going to have you tell me if you hear conduction equally in both ears, okay?
Okay. Yep.
Okay, awesome. Now what I'm going to do is I'm going to put this tuning fork behind your ear, and you tell me when you stop hearing it, and then in front of your ear, and tell me when you stop hearing it, okay?
Okay. Okay. Okay.
Okay.
Okay. Okay.
All right. So the air conduction is greater than bone conduction in both ears bilaterally, which is normal. Normal finding and what we want to have happen. So what I'm going to do is I'm now going to look inside both of your ears, okay?
Okay.
So it'll only take a minute. Maybe slightly uncomfortable though, okay? So I'm going to pull your ear up and back. And I'm gonna look, I see a little bit of cerumen, your tympanic membrane. It's grayish pink. I don't see any fluid buildup behind it. See the cone of light, no thickening of the tympanic membrane, which is good. So I'm gonna look in this other one. Okay, a little bit of cerumen in this one as well. You see the cone of light though, tympanic membrane. It's grayish pink in color as well. No fluid buildup behind the eardrum, and no thickening of the tympanic membrane either. Okay, thank you so much, Brittany. Now what I'm going to do is inspect your nose. I see that the skin color of the nose is consistent with the rest of your face. I don't see any redness or any irritation or anything of that nature. I do see your nose ring on the right there. Brittany, have you had any congestion or drainage coming from your nose? Okay. Anything out of the ordinary? Okay. What I'm going to do is I'm going to just look inside your nose for just a second. Okay. So I'm first going to see that her septum is undeviated, which is good. So I'm just going to look inside your nose. Okay, I see her turbinates are nice pinkish red. And septum does not appear to be ruptured or have any tears or anything. Yep, turbinates pinkish red. And no rupturing or tearing of the septum on that side either. Now I'm just going to feel your sinuses, your sinus passages, and I want you to tell me if you have any tenderness or pain, okay?
Okay.
Any pain there? Pain there? Okay, great. Good. So no pain, no irritation in that area either. So now what I'm going to do is look at your mouth. I notice first off right out of the gate, your mucous membranes are nice, moist, and intact. Your lips don't appear to have any cracks. They appear moist in nature and they're pink. I'm going to have you open your mouth for me, Brittany. Yep, I'm going to see that teeth are white. I don't see any cracks or any signs of irritation. I also see that there's normal distribution of the teeth. I'm also going to, I don't see any that are missing either. I'm also going to look at your gums. Okay. I'm just going to, sorry. Just going to pull right back here. Okay, so her gums are nice and pink. I don't see any lesions or anything like that. I don't see any yellow discoloration, white patches, anything of that nature. And then, Brittany, I'm going to have you open up your mouth for me. Okay, and I'm going to have you stick out your tongue. Okay, and what I am going to have you do is, hold on one second. What I'm going to have you do is stick out your tongue for me. I'm going to go ahead and swallow for me. So I see the uvula, it's nice and pink, and it's not deviating from one side to another. Brittany, I'm going to initiate your gag reflex, okay? I'm going to have you open up your mouth. Maybe. There we go. All right, so she has a good intact gag reflex. Go ahead and say ah for me. And there is good movement of the uvula. I see the soft and the hard palate are intact. And so what I am going to do next is just look at your tongue. Stick your tongue out for me again. Move it from side to side. Yep. Left side first. Yep. And the right side. Good. So I see it's nice and vascular. It's pink. I don't see any irritation spots on it. I also don't see any white marks on it either. So now, Brittany, lastly, I'm going to look at your neck. And so I'm just going to look at your neck here. I see off first glance that I don't see any goiter. Her neck appears to be symmetrical bilaterally. And the skin appears to be consistent with her face and her upper chest. Okay, I do see some nevi again, but I don't see any lesions or any irritation spots or anything like that. So now what I'm going to do is palpate your lymph nodes, preauricular, postauricular, occipital, superficial cervical, and down into your deep cervical chains, okay? And then your posterior clavicle and your supraauricular. And then I'm going to feel your mandibular, submandibular, and your mental. And I don't feel any of them, which is normal. Don't want to feel them. Have you felt any pain, any issues whatsoever? Okay, great. So now what I'm going to do is I am going to have you extend your neck up like this, and then flex your neck down. Good. So up and down, and then I want you to move side to side.
Like this?
Yeah. Great. So she has great movement of the neck. It's uninhibited. I don't see any difficulty with that movement. Brittany, did you have any pain with that whatsoever? Okay, great. So now what I'm going to do is I'm going to palpate your trachea, and then I'm also going to palpate your thyroid. And so to do that, I'm just going to feel the trachea, and it appears to be undeviated. So what I'm also going to do is I am going to feel for your thyroid. So what I want you to do, Brittany, for me, swallow. Good, and I feel good movement of the thyroid gland, was able to palpate it, but didn't feel any masses or nodules noted on it. And so that concludes the head, ear, eyes, nose, and throat assessment. Thank you so much, Brittany, for being my patient today and for letting me take care of you. I would go ahead and take off my gloves and wash my hands and exit the exam room.